Hello Malaysia and welcome to another edition of Medical Today with me, Jared Ratnam. This is episode 12, season 3.0. Time has certainly flown by. But on today's show, we've got a lot happening for you. We have a first aid video which comes on in the end. We'll also be talking about bariatric surgery. But for now, we want to delve into vitamins or to be exacting supplements and how to use them. And joining us once again in the studio is Emely Chai, consultant pharmacist from Blackmores, Malaysia. Emely, thanks for joining us on the show. It's great to have you here once again. You were here before talking to us about vitamins and supplements and the little things we need to know. But I guess today we're going to delve into a few more things. And I think the first thing we need to talk about is the digestive system and its importance. So where do we begin with this conversation?
When we talk about digestive system, it's extremely important because it is where, all our nutrients are being absorbed, being digested and absorbed. Okay, and the nutrients are the one where, it will repair our cells, give us energy, okay, keep our immune system up, so, you eat the good food, but you have to make sure that they are all digested and also you get nutrients that you need for your body to function. Yeah.
But I guess the other question is to dial back and find out how the digestive system works, because I think we fail to forget that the digestive system has its own mechanism and it's got its own way of working. So how would you simplify this and explain this to us?
Okay, well, when we talk about digestion, it actually involves two main parts: the chewing, okay, which is the mechanical part, and the chemical part, which is actually our enzymes, our acid, it's the one that helps to digest the food. And at the same time, when we chew our food, actually enzymes already start producing while we're chewing. And we actually have to chew at least 15 to 20 times in actual before we actually swallow our food.
Right.
Yes, because that's the enzymes are being produced, amylase enzyme to be exact. They are the one that's going to digest our carbs mainly, all right, our sugar. So it's quite important, that it comes from the chewing and the whole process of the food getting down and getting digested properly, all right, so that it can be absorbed into your small intestines. Yeah. Right,
but also if you look at it, when you talk about poor digestion, I guess it also goes back to the way we eat now. In this day and age with modernity and our fast-paced lifestyle, so to speak.
Correct.
Most of us, chomp down our food during our lunch break, and then we're back in the office belching or sometimes regurgitating that food without even knowing. Now, is this a problem?
Yes, indeed it is. A lot of times, you see nowadays there's more and more issues, people having indigestion issues. They tend to burp more, or they get bloatedness, or they even get nausea. So all these actually, it actually is a sign that something's wrong, because our digestion system actually, how our digestive system, whether it's healthy or not, it will tell, how your overall health is. Let's say constipated, it shows that there's something wrong, that we need to do something about it.
Right. So now if you go see a gastroenterologist or someone who knows a lot about the gut, even a physician, they're always talking about bloating, heartburn, like you just mentioned, acid reflux, there's nausea, some people have poor appetite. Now it always goes back to them saying, yeah, you need to make lifestyle changes, you need to eat well, you need to eat on time, but all this for me is like wishful thinking in today's world. But I think the biggest problem for men and women, more so women, is the bloating issue. Now, when you talk about bloating, what are we dealing with here?
Bloating is basically meaning your food is not being digested properly, or maybe sometimes your stomach is just very sensitive. Sometimes there's certain food which you can't take. Let's say, people who are intolerant towards milk, dairy products, all right? Maybe their body is not producing enough of the lactase enzyme, all right? It doesn't break down your milk or your dairy, food, and therefore it causes the bloatedness because it's not being digested properly.
Right.
Yes.
Right. So also, I think just to digress a little, a lot of people talk about motility, and when you say motility, it's about your food going down the right way, not backing up.
Yes.
So motility is movement throughout your gut system, and people now like taking digestive enzymes. They're taking, domperidone. They're taking all these drugs for motility. There's domperidone. There's also other brands out there like Ganathon, so on and so forth. But I guess taking these things long term doesn't quite help.
Yes, basically they're just helping in a symptomatic relief. Basically, it's just to relieve the wind and all that. Okay,
Right.
but it doesn't really solve your actual issue. Okay, of course you will still need them when you have it, but there are other ways which you can actually take. For example, there are actually digestive enzymes products in the market where you can actually take right after your meal. So that it can help to digest, most of the type of food that you take, like carbs, protein, even the dairy products.
Hold on here, because it's very interesting that you say you take it after your meal.
Correct.
Many people have got many ways of dispensing this piece of advice or tip. Some say that you need to prep your stomach before food enters by taking that digestive enzyme first and then eating. Some people say take it with food. I really don't know what that means. And like you said, take it after food.
Yep.
So what's the go-to standard advice for this?
Usually when we say after food, it means within an hour of your meal, all right, because the food is actually not fully digested yet. Of course, the best is you take it right after, meaning you take your meal, and right after you finish your meal, you can take your, product, your enzyme product. Yes. So, yeah, you can do that.
All right, so people who basically need an enzyme to help them with digestion would be people who are having a stressful lifestyle,
Correct.
Having unhealthy diets. But I think the other question with regards to taking enzymes is there's many different enzymes out there. Is there a mixture of all these enzymes, or are there certain enzymes targeted for specific problems?
Okay, because if you see our Malaysian diet or even Western diet, they will have carbohydrate, they will have protein, they will have, some form of dairy, like cheese and all that. All right, they will have fats.
Right.
All right, and they will have some vegetables, so things that with fiber. So these are the food that we normally eat every day. So look for a product, that has all these few type of enzymes, all right, that can digest these, main food that we normally take every day.
Right.
Yeah.
So in my list here we have amylase, protease, lipase, lactase, and cellulase.
Correct.
Now, how would you explain that? Are these different enzymes, and what do they do?
Yes, they are different, all right? So they have their, like for example, amylase is the one where it digests your carbohydrates, all right?
So amylase digests carbohydrates.
Yeah.
Okay.
And then your protease, all right, usually will digest your protein, all right? And your lipase is to digest fats. Lactase is to digest the dairy products that you're eating, the food, and the cellulase is to digest the vegetables, the plant, we call it plant fibers or vegetables that you take, because our body actually cannot produce lactase.
Right.
So some people who take a lot of veggies, they may have some discomfort because, they're unable to, if they are not drinking water, maybe they can't go to the toilet, things like that. Yeah.
Right.
So, we are just taking so that, we can digest them more properly, more complete, so that you can absorb all the nutrients.
Right.
Yes.
Yeah, so I guess, for those of us in our 40s and 50s, I think bowel movement or good bowel movement is like a luxury these days because we don't do enough, to keep the bowels moving properly.
Correct.
Now, the other problem with taking enzymes is there's a lot of news out there which also state that if your body is not producing these enzymes and if you're taking it, you may become dependent on these enzymes. Is there any truth to this?
I don't think you would become dependent, right? Because firstly, the people who need them, they're just not producing enough. For example, elderly, they tend to, they just slow down the production. Right. That's why you see elderly people, they tend to eat very little. And they only eat maybe just rice, noodles, okay? They're not eating because their stomach cannot take it. So they're not actually getting all the nutrients that they need actually. Right. So, if it helps them, to take the enzymes, and it actually helps to digest them, and so that, it helps to curb the issue and they can eat more happily. Maybe there are some people who can't take milk. They take the product and they actually can,
So it's usually a problem, you go out for a good meal and you come back to your office, you have a meeting, and then you have to sit down there and belch, or try to stop that belch from happening.
Correct. And it can get quite embarrassing.
Yeah, it can get quite embarrassing.
Yes.
Sometimes it comes with an odor with it. So these things are very prominent these days in today's lifestyles.
Yes.
So I think the other thing is, people are also talking about, while we're talking about enzymes, why aren't we talking about pro and prebiotics? Because apparently they sort of do the same thing.
Okay, there's a major difference between these two actually, probiotics and also enzymes. Probiotics are actually much more popular, to be honest, because a lot of people actually are taking it because they realize, it's actually good for them. And it's true, probiotics are actually very good for your gut health, all right? It basically builds the immunity of your guts, all right? And digestive enzyme is basically more for digestion of the food. So it's really quite different. And these two actually work very well together. Yeah, so, people sometimes they just take probiotics, they don't take enzymes. But, it doesn't really curb the issue, completely, because their body is not producing enough enzymes, and also we are not taking enough food that is rich in enzymes.
Right.
Yes.
Well, if you're just joining us on the show, we're speaking to Emely Chai, the consultant pharmacist for Blackmores, Malaysia, and we're talking about digestive enzymes. We're also talking about probiotics and prebiotics. Now, going out there and buying probiotics and prebiotics, there's some that you refrigerate, some that you don't, some they say have run adequate tests, some have not. Then there comes the 2 million or 20 billion IU. What's all this telling us? What do I need to know when I buy a probiotic? Because I go to a pharmacist and everyone's trying to push stuff to me. So what do I need to know about this?
Actually, mainly probiotics, because when you take a probiotic, you should take a prebiotic as well, because it actually helps to multiply. Prebiotic is basically food for the bacteria. So you are like having a pet, bacteria is a pet, and you're feeding the food.
This is a pet.
And then you're feeding you need to make sure your probiotic, your bacteria survive, so you have to feed them with food. So the prebiotic and probiotics is very, very useful to make sure that it continue to multiply.
Right.
Yes. And whether it's refrigerated or non-refrigerated, depends on the technology of the probiotic. Some of them, they are specially coated, they are heat proof, like the one refrigerated. Some people, they prefer the one that is not refrigerated. Actually, it's okay, it all depends on the technology. It's okay.
Right.
Yeah.
Now, the other thing, when we talk about our gut health or digestive system, another thing that we need to look at closely is our liver also.
Yes,
Our liver and other things that come along with it. But let's talk about the liver first.
Okay.
Now, with liver, a lot of us suffer from a fatty liver. Back in the day, those who had a fatty liver were known to have had good drinking skills. Right? Today, it's not the case.
Yes.
Most of us who don't drink or imbibe in alcohol still get fatty liver. Why is that?
Yeah, actually fatty liver, there's two main types, all right? One is alcoholic liver, fatty liver. Another one is a non-alcoholic fatty liver.
Right.
So non-alcoholic fatty liver actually is more common because nowadays people actually, due to poor diet, stressful lifestyle, we don't get enough sleep. The food that we take are, mainly carbs, fast food. So we actually taking a lot of, all this type of lifestyle, diet and lifestyle stress actually causes our liver to be stressed because we're actually taking in more chemicals nowadays. I mean, the food that we're taking are a lot of fast food are actually chemical based, and therefore, we are actually burdening our liver. So our liver actually, the function of liver basically is to detox, to clear off any toxin or whatsoever. But because we are not detoxing enough in a sense, and we are overloading the liver with lots of rubbish in a sense. So it's just like our liver is like a dustbin, where you don't clear it, the dustbin gets clogged up. Eventually, the toxin will leak out into your blood, and
and one day someone will find out that a human foie gras is better than the foie gras we get in the market, and that's going to be dangerous for us. So it's best we look after our liver. Now, when you talk about liver health, what can you do to reverse a fatty liver?
Right. Yes, it's right. Fatty liver actually is still reversible,
I
so
think
which
the
is
question
good.
is, can we reverse the fatty liver?
Yes, can. Okay, fatty liver can be reversible, and at the same time, but not when it reaches cirrhosis level.
Right.
Okay, if you don't take care of your liver, let's say you have fatty liver and you don't take care of it, it will advance to cirrhosis. It may advance to cirrhosis, which is the hardening of the liver cells. And that is no turning back already.
Right.
Yeah. But if you're still having fatty liver, you've been just checked by a doctor and, doctor has confirmed you have fatty liver, it is still reversible. There's something you can do about it.
Okay, so here in the list, it suggests that we take milk thistle, there's phospholipids, there's zinc and chromium. Now, milk thistle, there's a lot of arguments going on about milk thistle. We'll get to that. What interests me here is chromium. Okay, now, they say that chromium helps with reducing bringing down your sugar levels just after you eat. So it'll help you regulate your sugar levels.
Okay.
How does it help with the liver?
All right, because the liver actually helps to metabolize our food, all right, like fat, carbohydrate, protein, okay? The liver actually helps to, to digest them, to actually chemically digest them, okay? So, chromium, basically when we are overloaded with sugar, salt, too much of that, our liver gets, overloaded. Right. Yes. So chromium actually helps to metabolize some of that. It's part of metabolizing your fat, the food, the protein,
right.
Sugar.
Right. Yeah. Okay. So easily said. So now if you have milk thistle, you have phospholipids, you have zinc, you have chromium. That's like 4 different supplements for one problem. Do you get an all-in-one? We Malaysians, we're looking for one pill to cure everything.
All in one, 3 in 1.
Yeah, I know. It's a dream I hope we achieve soon. Yeah.
Yes, actually, there are products which have all this few. Like there are products which have phospholipids, zinc, and chromium actually in one product. Whereas milk thistle, you have to buy them separately. So if you talk about milk thistle and phospholipids, how do you differentiate them, or what's the difference?
Correct.
Milk thistle is more like a herb, and it helps to detox your liver. And phospholipids more towards repairing the liver cells. Okay. Yeah, just imagine your liver.
So milk thistle detoxes.
Correct.
Phospholipids
repairs them. Okay. Correct. And also it helps to regenerate new liver cells. Our liver actually can regenerate itself. Yes, provided you have the correct nutrients.
Right.
And our liver cells are actually made up of phospholipids. Yes. So it's like, imagine your liver. There's a lot of holes. And enzymes actually leaking out of it. You realize you have liver enzymes, high liver enzymes.
Right.
Yeah. So the phospholipid basically to patch up all these holes that you have on your liver. Yeah. To make it simple to understand. Yes.
So saying if you had a bout of dengue, I don't know why, but when people come out of the hospital after dengue, the other thing is for those of us who want to go out and buy a supplement for a fatty liver or for liver health, what would you recommend for us to do? What do we look out for?
It depends on what type of condition you have, all right? Some people who are diabetic, they have they're smokers,
right.
All right? They take alcohol, all right? They have a poor lifestyle, okay? I would suggest that to take both milk thistle and also a phospholipid product, all right? Because you need double action.
Right, double action.
Yes, double action. Okay. But if let's say someone who is just a little bit of tummy here, and then maybe just taking too much of meat.
You have a little bit of a girth here. So just stick to milk thistle. That's fine.
Milk thistle. You can start with milk thistle. Yes, but if let's say you have some underlying issues like diabetic, or maybe you have some other conditions like even heart condition, cholesterol, cholesterol, high cholesterol. So it's good to combine these two together so it can have a more synergistic effect. Yeah.
Right. So milk thistle and phospholipids. Emely, once again, it was a pleasure and an honor to have you with us right here on Medical Today. She's a consultant pharmacist with Blackmores, Malaysia. She joins us whenever she can to give us some information about supplements and multivitamins, so on and so forth. We talked about the digestive system. We also talked about liver problems today right here on Medical Day. Thank you very much. Stay with us. We'll be back just after a short break right here on Medical Today, episode 12, season 3.0. Thank you for staying with us right here on Medical Today with me, Jared Ratnam. We have a very interesting subject that we're going to talk about now, and it's restoring health through bariatric surgery. What's that all about? We have a guest in the studio to share that with us. Joining me is Datuk Dr. Haron Ahmad, consultant surgeon for general and hepatopancreatobiliary, or to make that short, you're a liver surgeon, isn't it?
Yes.
So it's hepatopancreatobiliary surgeon. Wow, that's quite a word. Yeah. Yeah. Can you say it in one word?
Yeah, hepatopancreatobiliary.
Oh, okay, you can say it. Very good. Thank you very much for joining us on the show. Now, I think my first question to you is, why did you take up bariatric surgery from what you were doing?
Yeah, I would like to thank everyone for inviting me coming here to Bernama to talk about the subjects of obesity surgery. It is I don't know what made me go into bariatric surgery. I'm actually a liver surgeon. Usually I do liver surgery, pancreas, or gallbladder surgery. But because I was doing a lot of laparoscopic surgery, keyhole surgery, started since early 90s,
Right. That's when keyhole surgeries or laparoscopic surgeries started becoming big in the
Yes. Yeah. So, because I do a lot of laparoscopic surgery, and bariatric surgery seems to be better and safer by this technique. Earlier on, when I was in UKM, bariatric surgery was started by my professor there and my colleague. They were doing open surgery for bariatric surgery. This method caused a lot of morbidities and mortality. So later on, they started this bariatric surgery using this method. Laparoscopy, and this just opened up, it is a new thing, it is a new ways of managing, which is better, less morbidity and less mortality, and patient can go home earlier.
Well, it's very interesting as to how you got into this, but I think moving from what you did, liver surgery, as opposed to what you're doing now, there was a learning curve also. You had to start learning laparoscopic surgery, using the tools, so on and so forth. Was it tough for you at that time in the 90s?
Yeah, as a new method of surgery, this laparoscopic surgery was found to be difficult because you need to learn. Like you mentioned, there's a learning curve. But once you are used to it, it becomes easier. But I always advise surgeons who wants to do this laparoscopy, they have to go through a normal process. They have to be a general surgeon that have done open surgery first before they start doing this.
So what you're saying is, if you want to do laparoscopic surgery, or if you want to get into laparoscopic surgery, you need to understand general surgery first, the basis or the basics of surgery in and of itself.
Yes.
So this is a very important thing for surgeons to know. Getting to laparoscopic surgery is not a problem, but having the basics of surgery is more important. So what were some of the stumbling blocks for you at that point when you started getting into bariatric surgery or laparoscopic surgery to help with obesity and restoring health?
Yeah, to me, and because I started doing this laparoscopic surgery, to do any other operation laparoscopically is easier. So when bariatric surgery is done through this method, so it is not that difficult for me. But the problem is because I'm not the bariatric surgeon, so I have to go and learn. That's why I was given a task, to start this bariatric surgery at KPJ, especially in Damansara Specialist Hospital. So I was sent to US to learn and come back and to start this center, of course with the help of my friend from US, for 1 or 2 years. And now the centers, and then I'm managing the center and all the surgeries by myself.
Now it's interesting that a lot of people are opting for bariatric surgery. Maybe walk us through what bariatric surgery is and how does it restore health in people whose health is otherwise.
So bariatric surgery is basically operating an obese patient for them to lose weight. Yeah, there are many ways of losing weight. Not only surgery. Before surgery, they can do other things like they have to take care of their diet, and with exercise. If they cannot reduce their weight by this means, and sometimes they long time ago they started with some medicine, which is not nowadays some of the medicines have been banned, because of the side effects. So if they cannot do this, then surgery is the option. Surgery for these obesity patients, it is good in the sense that it is a sustainable weight loss method, not like medicines or dieting, because once you lose weight, you start your bad habit.
Right.
Again.
But therein lies a problem, Doctor. Sorry for moving in here, but when you talk about weight loss, you're talking about a problem with obesity in the first place. And when you talk about obesity, you're already putting into place other problems like non-communicable diseases that are already there. You have diabetes mellitus. Some people may be borderline hypertensive, or they already have hypertension. There's so many other problems that come along with obesity. So how do you deal with these problems, and how do you establish or ascertain if bariatric surgery is for this individual or not?
Nowadays, bariatric surgery is defined as a chronic disease, defined by WHO, even lots of societies, including endocrine societies. So it is a mother of all disease, actually, to start with. So if you have obesity, the chances for you to get chronic diseases, especially metabolic disease, like diabetes, hypertension, hypercholesterolemia, and heart problems is there. You will get it one fine day. You will get it. So if you can lose your weight, 5% to 30%, you are sure, you won't get this kind of disease, or maybe easier, for those who have diabetes, they can be cured, or they can be easily managed.
Right, but I'm sure there's a list of things, there's a checklist you go through, or there are certain parameters that then they need to be in before one is able to go through that procedure. So what do you look for when you first meet a patient? What are you looking for? What do you talk to him or her about?
Yeah, usually they come to you, for an advice. They want to lose weight. That's all. Most of them, they don't understand about why they want to lose weight. Only certain percentage of people come. Okay, I'm having diabetes. I can't walk properly, and because of my weight. So can you help me to lose weight? So actually, the important thing is not really to look thin, losing weight, but the important thing is the disease that you have, and especially diabetes. Diabetes can cause lots of other problems. If you have diabetes, you get complications of diabetes. You get heart problems, kidney problems. So for type 2 diabetes, which is related to weight, if you can lose weight, you can almost cure type 2 diabetes. Or at least, if it's too bad, you can the diabetes is more controllable.
If one loses weight now, you can reverse type 2 diabetes.
Yes.
That's what you're saying.
Yes, yes.
Wow, that's quite a statement because
long time ago, a friend of mine, very famous professor, told me, Haron, one day, the treatment for diabetes type 2 is going to be surgery. So, I'm not an endocrine physician. I said, is it true? Yes, you just watch my words.
Right.
And this is now.
Okay, while we're talking about diabetes, and of course we're talking about bariatric surgery, the story that is coming here is diabetes mellitus, and type 2 diabetes basically is a problem with the pancreas. Now, you are a pancreas expert. You, as a liver surgeon, you deal with the pancreas, the gallbladder, and the liver, right?
Yes.
Now, do you think something can be done in the future in order to reverse type 2 diabetes through tweaking the pancreas, so to speak?
Oh, that is, the lots of the cause of diabetes is not actually just pancreatic
Okay,
problems.
so if it's pancreas based, do you think that something can be done then?
If it is pancreas based, usually it is related more toward type 1.
Type 1.
Rather than, unless you have chronic pancreatitis, a small portions of people with chronic pancreatitis, they can have diabetes. Usually diabetes type 2 is more towards weight and more toward insulin resistance.
Right.
Cell which is resistant to insulin.
So what you're saying in essence is losing weight and bariatric surgery can help you reverse type 2 diabetes.
Yes.
Right. And that's good news. Now, for people who've seen you, when you come for a procedure, you want to lose weight, you come for a procedure, they see you, they're ready for the procedure, they go through the procedure, how long will they be able to get back to a normal lifestyle?
In fact, you can see quite, not immediately, within 1 or 2 weeks, you can see, especially diabetes. After the surgery, we don't, the endocrinologists don't start them on their medicine anymore, because the sugar level is down. That's why it is fantastic, to look at. In fact, my endocrinologist in our hospital now start believing that surgery might be the answers for type 2 diabetes.
Okay, so who in essence, or who will want to opt for bariatric surgery? Of course, people who are obese. Who else? Is there a list of people that should opt for bariatric surgery?
Yeah, now if we are talking about type 2 diabetes, it's all obese patients, and it has to be usually diabetes start creeping in when the obesity is too bad. Usually a very bad diabetes. But there are some people also, where they are just type 1, class 1, obese, or class 2 obese, they have this diabetes, and that patients needs help from.
Now, when you're talking about obesity, correct me if I'm wrong here, and also bariatric surgery, one organ that people look at a lot is the liver.
Yes.
Yeah, with obesity, you may stand a chance, or you might stand a chance of developing a fatty liver.
Yes.
Or what we now know as a non-alcoholic fatty liver.
Yes.
Now, say after bariatric surgery, what then happens with the liver? How do you deal with that problem?
Usually, once you have fatty liver, it's very difficult to,
Bad news.
to treat that.
Okay.
But the fantastic thing about liver, because liver regenerate, so those cells who are involved with this fatty liver will just die and shrivel away, but the new liver cell will grow. So when we do this surgery, we stop the liver from progressing into bad one. From let's say mild or moderate fatty liver goes to cirrhosis. At least we can stop it. But to cure properly, fatty liver, I think is difficult.
Difficult.
Yeah.
Now, we're going to get back to that, but let's talk about pregnant women for a while. Now, after a bariatric surgery, can a woman get pregnant?
Of course, it can be. In fact, some of my patients after the surgery, periods are getting better, okay, and they can conceive. Because most of these people, they have this what we call polycystic ovarian disease syndrome, and difficult for them to conceive, you know. So I remember about 3 or 4 of my patients, you know, they have babies and they're very happy.
And you know, that's sort of rather successful.
Yes.
Yeah. Now, for those of us who don't have an idea as to what happens post a bariatric surgery, now, you know, one would think that someone comes in obese, he goes back looking like Cameron Diaz. Nah, no. Does that happen? Can that happen?
Yeah, it can happen, but the first thing I will tell them, you know, this is not plastic
not
surgery.
he, sorry, I said she. Okay.
No?
Yeah.
I'll tell them this is not plastic surgery. This surgery is for your health. But for as a side effect of it, or you know, you can look beautiful after this. You know, we need some plastic surgical help for those who lose weight with all the flabby skins. Or that, the plastic surgeon have to come and help to remove the skins and to tighten up.
Right. So post-operative care would also you would also recommend for plastic surgeon to come in and see where they can help with loose skin.
Yes, for those patients who wants to have plastic surgery, but most of my patients, I think almost about 80%, they don't care, you know. As long that they lose weight, they're happy, you know. It's okay to just hide this flabbiness under the shirts.
Right. Now, doing bariatric surgery and moving from what you were doing before, from being a liver surgeon, or to better say it, I'm going to try it again, hepatopancreatobiliary surgeon.
Yes, that is correct.
I finally got it. I finally got it. Okay. And what are the latest developments in laparoscopic surgery?
Oh, this is, I know.
Or even bariatric surgery. What's the latest? Can you like kind of suck out fat straight away?
No, not really. No, you know, there's not much in surgery, you know, because when we do open surgery, we started with all kind of method. Now only it is done laparoscopically.
Right. So I think the bigger question for the viewers, and this came to me just before I got into the interview, someone asked me, please ask this doctor, what's the difference between liposuction and what he does?
There is a lot of misconception. Liposuction is actually sucking out the fat under the skin, and it is done by the plastic surgeon. Bariatric surgery is to reduce the fat for the whole body. So you cannot liposuck the fat throughout the whole body.
So you can only liposuck fat in certain areas. Okay, when you say certain areas, which areas are we talking?
Usually it's abdomen. Abdomen, thigh, your arms, you know. So before they remove the skin, it has to be nice and supple.
Right. So that kind of explains liposuction. Now, bariatric surgery, it is a surgery, it's laparoscopic. So you're going in, which areas can laparoscopic help with that liposuction can't help?
Usually it is, when you lose weight, you have this skin apron.
Right. A skin apron, yeah?
It's hanging sometimes right down to the middle of your thigh. This apron can be a problem to those who lost weight, because underneath the skin apron there'll be a wet area, very wet, and then sometimes you get fungal infections on that. I'm looking more towards that rather than removing skin to make you beautiful. Okay, but of course you can have that too, but managing the infection underneath the skin. So it is difficult.
Right. So when you talk about managing infections, once again, we go back to the underlying problems that one would have with regards to going through a procedure, saying, I've got diabetes and I go through a procedure. Now I have to manage this apron around my body, which may stand a chance of becoming infected. Now, an infection is something I don't want if I'm having diabetes. Am I right?
Yes.
So how would you help with that?
So, diabetes has to be controlled, of course, after the surgery. diabetes is better and better control, maybe gone. And the flabbiness, we have to ask them to go and see our friend plastic surgeon to remove the skin and tighten it up, so you don't have all those crevices, that infection can happen.
Now, there's a saying that Malaysia is now one of the fattest nations in Asia, Malaysia boleh, and knowing what we know today about why we've become the nation we've become, and obesity setting in, what would be your advice to all of us? What do you want to tell us? Like all of us take putting on weight for granted. When you tell your fat, hey, you need to lose a bit of weight. Hey, what you mean I'm fat? People don't like talking about it. But there's also another set of people who don't greet you. When they greet you, they say, hey, Doctor, lama tak jumpa, gemuk sangat, Doctor ni kan. There's two ways of looking at it. As a nation, we're always worried about how someone looks, and if we also wanted to offer advice, some of us can't take it. So now, what would be your advice or your tip for us?
I think the first thing they should understand, what is obesity, what can obesity cause, the problems related to obesity. This is more important, and understanding the disease that come from obesity rather than, and some more. To use the word obese, that it's not that nice,
It's not nice.
It's not nice. So
it's rather crude.
Yes. So that's why when we first started, our center was called Severe Obesity Center. So we look at that. No, this is not good.
Two words.
Yes, severe and obese. So now we've changed the center name to Diabesity.
Or Diabesity.
Yeah, it is diabetes and obesity because it is interrelated. It is better and better, sounds to the.
Yeah, I mean, it has to sound pleasant. Say if you have severe obesity as a sign, and someone has to walk in there.
Yes.
Doesn't quite look good. So I mean, semantics are all very important these days. So
I think that's why they put me in the 5th floor.
They put you in the 5th floor.
5th floor. The center is it is the only clinic in center in the 5th floor of my hospital. So that patient can come straight. So
privacy is very important. Yes. So privacy is maintained there.
Yes.
And first you would have thought that people didn't like you, so they put you out there.
I thought
you thought so at first, but it is about privacy. Now, when you talk to people who are overweight and who really need help with weight, it's very hard to open up, saying if I've put on, and I was a fat kid, when I was 13, 14, I was a fat kid. And I found a way to lose weight now. But the way I went through was, it was not good. Now, I started smoking because I thought that will help me lose weight. And that was bad at the age of 13. Now, when someone is big, and if you want to play with other kids, you want to go out with your friends, there's always social stigma.
Right.
And I'm sure there's a psychological area which you deal with. You talk to your patients, it happens to all of us. How do you, what do you talk to them about?
I will start talking about disease and illness, and then slowly creep into the obesity thing that causes the weight. So it is. I will tell them it's good for you to lose weight, to reduce the chances of getting all these chronic illness, and you're still young, Once you reach age of 40, 50, with your increasing weight, you can have all these problems. You'll be in and out of hospital, for many times, and you get all the complications. If it is diabetes is bad, then you get all the complications: diabetes, kidney failures, your eyes, you get cataract and retinopathy, sometimes infection of your limbs, you can get your limb amputated. So we don't want all this,
Right. So I'm guessing that you've treated patients who've seen themselves after a procedure and who've cried to you. Have you had people cry to you saying, wow, thank you so much for what you've done? Has that happened?
Yes, most of them come to the doc, and I should have come here a long time ago. I should have got this operation a long time ago. They're so happy, and most of them, especially those who are single, they get married soon.
Right.
So the important thing, they feel lighter, you know. They can walk properly, especially for Muslim. They can pray easily.
Praying for solat and all.
Yeah. Otherwise, it's difficult. They have to sit on a chair, you know, to pray. But they feel better. And of course, ladies are happy, you know. They especially they come to you sometimes. They bring the old clothes, you know, big ones. So, doc, I can buy a new one.
So once again, if I feel like I think I'm overweight, I don't know, maybe, what's my BMI, how I'm going to work through this. Little things like this can be worked through. All you need to do is get the right advice. If you want to look for Dr. Haron Ahmad, all you need to do is go to KPJ Damansara Specialist Hospital. He's right there on the 5th floor. He's alone. So you don't have to worry about privacy, and no one's going to see you. So with that, we'd like to thank you, Datuk. Thank you very much. It was a pleasure and an honor to have you here. And thank you very much for joining us on the review. Stay with us. We're going to come back just after a short break right here on Medical Today. Thank you for staying with us right here on Medical Today, episode 12, season 3.0. We'd like to thank Dr. Haron Ahmad for joining us on the show and for giving us an insight as to the important parts of bariatric surgery and all we need to know with regards to that. Now, on the show, we have a question that we're going to be asking in a short while. Stay tuned for that. It is something about our first segment. So think about what happened in the first segment. I'm going to come back with the question. In the meantime, we're going to play you a video on a weekly basis right here on Medical Today in season 3.0. We bring you a video about first aid mistakes. Now, when someone is dehydrated, do you give them a fizzy drink or a soda? No is the answer. Why? Let's take a look at this video and find out.
The mistake, giving a dehydrated person soda. You can become dehydrated for many different reasons. It could be from sweating too much. Vomiting or diarrhea can quickly remove fluids from your body too. By quickly getting a parched person something or anything to sip, you're making things worse. Avoid coffee, tea, soda, and diuretic drinks, especially alcohol, because they can dehydrate you more. Do this instead. There's really only one way to treat dehydration. Replace the fluids and electrolytes your body has lost. Water is your first choice, but there are lots of special drinks on the market that will help you replace your body's lost water and electrolytes. You can also alternate between 4 ounces of water and 4 ounces of Gatorade every 15 minutes while resting somewhere cool. If you don't feel better in half an hour, don't wait. Call 999 immediately.
Well, now you know what to do with regards to giving someone soda when he's dehydrated or she's dehydrated. So be careful what you do when someone's dehydrated. The last thing you want to give the person is soda. Well, water will do, always suffices. But I think the more important thing is, if you can't handle the situation, please call 999 and ask for some tips as to what you can do in an emergency situation. In the meantime, I did ask you about what happened in the first segment. We had Emely Chai, consultant pharmacist from Blackmores, Malaysia, joining us then, and she did talk about a few things. Now, she talked about the digestive system. Now, other than prebiotics and probiotics, what else can you take after a meal? It's some sort of enzyme. If you have the answer, send that answer to ask@medicaltoday.my. That's ask@medicaltoday.my. Send us your answer and we'll furnish you with a bottle of supplements courtesy of Blackmores, Malaysia. Now, the question, once again, is with regards to the digestive system. Other than pre and probiotics, What do we take to help or aid with our digestive system? It's some sort of an enzyme. What enzyme is that? Send me an email, send it to ask@medicalday.my, and we'll be more than happy to furnish you with a bottle of supplements. As always, we're looking for the first 3 winners. 1, 2, 3. First 3 winners will receive a bottle of supplements courtesy of Blackmores, Malaysia. Next week on the show, we'll be having Dr. Navin Rajadure, a consultant musculoskeletal radiologist, talking about diagnostics and intervention right here on the final episode of season 3.0 of Medical Day. On that note, I'm Jared Ratnam signing off. You have a fantastic day ahead and a great week, and we'll be back with more for you next week.